Hi.
You look very good today.
Feel very good, thanks.
And I heard that you're leaving Valley Cancer Institute.
Yes, tomorrow I fly out. Well, the reason I came to the Institute is about 2 years ago I was diagnosed with bladder cancer. And I went through 2 courses of treatment, BCG treatment. After the first treatment, they went in there and they still saw cancer, and they took a biopsy. So I repeated it again. I did it again for 6 weeks, repeated the test at the end, and they still found cancer. So only now the cancer they found was more serious.
Oh,
It could not be treated by the BCG. So I went to another urologist. I wasn't satisfied that I had gone through all of this and I wasn't any better off than I was in the beginning. So the first thing the new urologist did was send me for a CAT scan. And in the CAT scan, we saw the wall of the bladder at the bottom had a huge tumor in it, at least by my estimation, had a huge tumor. So he told me that the only thing that they could do would be to remove the bladder. And I would wear a bag on my side for the rest of my life. He also offered me chemotherapy, which I've had friends take chemotherapy and die, not from the cancer, but from the chemotherapy. He offered me radiation, not IMRT, but regular radiation. And I have had friends who I've had to help treat because of the burns on their body from radiation. So I wasn't going to do that. And then he told me that the surgery was only a 50-50 chance that I would come out of that with no cancer. I asked him, well, if I do nothing, doctor, how long will I live? And he said 2 years. So after I thought about it for a few days, I called him back and I said, I think I'll take the last alternative, because I'm more concerned with the quality of my life than the length of my life. Just by chance, a friend of mine, I've known him for 35 years, who knew that I was being treated for cancer and was just calling me to find out how it was going. So I told him what I just told you. He said, I'm gonna make a call and I'll call you right back. That's all he said to me. So he called me back in maybe half an hour. And he gave me the name of a doctor and a telephone number. He said, I've talked to this doctor. He's a friend of mine. I've known him almost as long as I've known you. And I want you to call him. He's expecting your call tomorrow morning at 10 o'clock. His name is Wolfstein. So I called him. And I told him everything I just told you. And he said 4 words to me. I'll never forget it. He said, I can help you. He didn't say he's going to take out my bladder. He didn't say he was going to give me any horrible radiation or chemotherapy. He said, I can help you. And he told me all about what you guys do here. He told me about the hyperthermia. He told me about the IMRT. He told me none of it would kill me. And that he felt there was a very, very good chance that, that's the way I feel, that I would be out of here cured, minimum 3 months, maximum 6. Well, he missed the 6 months by 2 weeks. I'm leaving 2 weeks early. I have had virtually no reactions to any of this therapy. In fact, my checkout that he gave me, my release, said that it's remarkable how few symptoms I've had, how little problems. We got the results last week. Negative. PET scan came back negative. The CAT scan came back negative. So all the tests are negative. So I'm going home tomorrow.
I am so happy for you.
The staff here, the nurses, the doctors, is the best. You have the kindest, most professional technicians or nurses working back there in that hyperthermia section in the world. And you've got the brightest, smartest, and sweetest two girls downstairs, Sylvia and Gigi, that do the radiation.